Welcome to our first class of the book club, where we take a look at interesting papers from the scientific literature. Well, the paper that we're going to take a look today is titled Association of Optimism with Cardiovascular Events and All-Cause Mortality, a Systematic Review and Meta-Analysis. It was published on JAMA. It's a very relevant, a very important scientific journal. It's open access, so anybody can access it and read it. You can look it up. The link is in the description. I encourage that. You can, if you want, download the article and try to read it along with the video, or you can just follow along. We're gonna read the article in its entirety. So it was published on JAMA, as I said, on 2019. These were the authors. Thank you for your work. And let's take a look first at the key points of the study, the main information about the study. Well, this is the key points. There are some studies that put them on the front, some don't have them, but it's very useful, especially when you're trying to tell the main message of the study to people who are not professionals on the area or don't want to dive too deep into the methodological details. So if you want to put the information if you want to explain the article in simple terms, the question this paper is trying to answer is a mindset of optimism associated with a lower risk of cardiovascular events and all-cause mortality? The findings of the study were, in this meta-analysis, we're going to talk about what a meta-analysis is, of 15 studies, including 229,391 individuals. It's a very large number of individuals. Optimism was associated with a lower risk of cardiovascular events, and pessimism was associated with a higher risk of cardiovascular events. The associations they found was similar to that of other well-established cardiac risk factors like hypertension, smoking, diabetes, overweight. What is the meaning of these findings? The findings suggest that a mindset of optimism is associated with lower cardiovascular risk, and that promotion of optimism and reduction in pessimism may be important for preventive health. Now, let's read the abstract of the article. What is an abstract? An abstract is a synthesis. It brings the main information of each section of the article. This is very useful when you want to know if this article is what you're looking for. Let's say you're interested in reading about optimism and health, and you're searching for articles about that subject. The abstract is important so you can have an idea of what this paper is about, and you can then decide if you want to dive into the full article or if this is not what you're interested in. So here we have the main information about each section of the study. We're gonna take a look at each of these sections in full, but the reading of the abstract will be very useful for the people that are seeing this video, this lesson, and they don't want to stay for the denser parts, for the more technical parts. So the reading and the discussion we're gonna have about the abstract will be enough for them to take a look at what is it like to analyze scientific papers and what are the main findings of this study about optimism and its association with cardiovascular events. So let's take a look. First, the abstract begins by the importance. What is the importance of this topic that motivates the making of this study? Well, the article reads, optimism and pessimism can be easily measured and are potentially modifiable mindsets that may be associated with cardiovascular risk and all-cause mortality. This is what motivates the making of this study. Well, then, what is the objective of this study? The objective of this study is to conduct a meta-analysis and systematic review of the association between optimism and risk for future cardiovascular events and all-cause mortality. What is a systematic review? A systematic review is a review of the literature. But it's not any review. It's a review that follows a very specific set of rules. So, the articles that are included in this review, that make up this review, are not randomly selected. They must satisfy a set of rules, a set of conditions to be included. Why is that? That is so because in that way we hope to have a more robust, a more certain answer to our question and a higher quality of information. And what is a meta-analysis? A meta-analysis is a type of statistical analysis. After you applied this systematic review, the systematic search of the literature, you ended up with some studies. These studies have some statistical data. If they have some statistical data and they are similar enough, they can be analyzed. And the meta-analysis is one of the tools to do that. And when you consider statistical data, numerical data specifically, meta-analysis can give us some of the information with the highest scientific quality, let's say, some of the highest scientific strength. It will depend on the quality of the studies that you used, that you included. That's why the systematic review tries to gather the studies with the best qualities. Well, it then enters on some details about data sources and the selection of the studies to be included in the review. They searched some electronic databases, PubMed, Scopus, PsycInfo. These are databases where the scientific papers are posted. Let's say you can search these databases to find the scientific papers, and you can make very specific searches. You can define rules for a search, and they did that in this review. These databases were systematically searched, so they were searched using a specific set of rules from their inception through July 2019. This was the year the study was published. And they identified all the cohort studies investigating the association between optimism and pessimism and cardiovascular events and or all-cause mortality. What are cohort studies? Cohort studies are studies that follow the group of people over time. So at the beginning of the study, they had a group of people. They have a lot of information about these people, and they follow these people over time. And they studied what happened today. And they had a lot of information about the risk factor that each person of that group had and what happened to each person over time. They hope to use this information to investigate this association, the association between optimism, pessimism, and cardiovascular events and all-cause mortality. They used the following medical subject heading terms. These is the terms that were used to search these databases. And here you can pause and read them, the terms that they used. Here the abstract talks a little bit about data extraction and synthesis. So, data were screened and extracted independently by two investigators, AR and CB. What does this mean? This means that they made this systematic search of these databases. So when they made this search applying the rules, they ended up with some articles. Of these articles, they looked them up and they saw which articles in fact satisfy all the rules they had set for inclusion in the systematic review. So after they ended up with all the studies that satisfied all the rules, they then extracted the information of each study. And these two people did this independently, and then they joined their findings. Here, on this next section of the paragraph, they talk a little bit more about statistical analysis and what they had to do about statistical analysis. We're going to talk about this a little more in the methodology section of the study when we read the study in full. Here they talk about the main outcomes and measures. And here it's important for you to know what is an outcome. An outcome or an endpoint is an event of interest to us. Here we are studying cardiovascular health. So our outcomes will be cardiovascular events. Cardiovascular events can be death by cardiovascular disease, myocardial infarction, stroke, new onset angina, all-cause mortality. Studies about other domains, studies about neurological diseases, studies about psychological health, behavioral studies, or other types of studies can have different outcomes that are of interest to them. Since here we are specifically talking about cardiovascular health and cardiovascular diseases, the outcomes we're going to consider for these studies are cardiovascular events like fatal cardiovascular mortality, that means mortality by cardiovascular disease, non-fatal myocardial infarction, stroke, and or new onset angina. Angina is thoracic pain by coronary heart disease. All of these, fatal cardiovascular mortality, non-fatal myocardial infarction, stroke, and new onset angina, was summed up and was one outcome. So the composite, the conjunction of all these topics, of all these types of events, is one of the main outcomes of the study. The other main outcome was all-cause mortality. This definition is important. Every study has to define what is the main outcome that it's studying, that it's interested in. Why is that? Every study you make, especially with humans, has a degree of uncertainty, has some possible factors that confound the results. So you have to design and execute your study to have the best possible answer you can have with the highest certainty possible, let's say. Your entire study will be designed and executed to give the best possible confidence, the highest possible certainty to as an answer to the main outcome of this study. The main outcome of the study will be the best information your study will give in terms of certainty, of the highest confidence you have in that result. Why is that important? First, so you can arrive at a result with the best possible certainty. If you don't have a clear idea of what is your main outcome, and you don't design and execute your study to try to answer this question, your main research question, while diminishing all the possible factors that can confound or obstruct your research, your study probably won't give a very satisfying answer, or it will not be very trustworthy. And there is another impact of this. When we, as readers, read this article, or when we, as researchers, try to use the information of this article in other research, we have to keep in mind what was the information concerning the main outcome and what was the information about other topics that were not the main outcome. Because we will know that the best information this article can give us is the information relating to the main outcome. If we are gonna read information about about secondary outcomes, for example, we have to keep in mind that this information is more subject to confusion, is more subject to uncertainty, to bias, and other things. We have to keep that in mind. We call this analysis of other outcomes that are not the main outcome secondary analysis or exploratory analysis. That is when we dive deeper into the data and we try to get ideas for future research. But we cannot use this secondary or exploratory analysis in full to arrive as an answer. We have to take them with a grain of salt, because we know that the article was not, this research was not designed and executed to give the best possible information about these secondary outcomes. The study was designed and executed to try to give the best possible information with the highest quality to the main outcome. We have to keep this in mind. So, the abstract then enters in the results section. So, after the researchers applied this systematic research, they ended up with 15 studies that satisfied all the rules. These 15 studies had a total of 229,391 participants. 10 of these 15 studies reported data on cardiovascular events, and 9 of these 15 studies reported data on all-cause mortality. The mean follow-up period was 13.8 years. The study that had the shortest follow-up followed the group for 2 years, and the study with the longest follow-up followed them for 40 years. This was the mean follow-up time. So what were the main findings? When they did their analysis and considered all their studies, optimism was significantly associated with a reduced risk of cardiovascular events, a relative risk of 0.65 or 65%. What does that mean? It means that the risk of the optimistic group, or the group with the highest optimism, was 65% of that of the other group, be that the group with the lower optimism or the pessimistic group. That is to say that being optimistic decreased the risk of cardiovascular events by 35%. This is a very large reduction, or as we call a very large effect size, the size of the effect of being optimistic. Similarly, optimism was significantly associated with a lower risk of all-cause mortality. The risk of the optimistic group was 86% of the risk of the other group. be that the group with the lower optimism, or we can call that the pessimistic group. And now we have a very important phrase. Subgroup analysis by methods for assessment, follow-up, duration, sex, and adjustment for depression and other potential confounders yielded similar results. What does this sentence mean? This sentence means that optimism had an effect that was independent of other things, had an effect that was specific of being optimistic. Why is that? Let's take, for example, health behavior. People that are more optimistic usually have better health behaviors. For example, they exercise more, they smoke less, they drink less. So, is the effect of optimism because of being optimistic specifically? Or is it because people that are more optimistic tend to have a better health behavior, and this health behavior creates the health benefits? This study tells us that there is in fact the effect of the health behavior, but optimism had an effect independent of this change in behavior and independent of other factors as well. Some of them they mentioned here: the method of selection, the follow-up time, the duration of the study, the sex of the person, the presence of depression, and other potential confounders that the study enters in more detail on the methodology section and the results section. What is important of this phrase? It means that optimism, this mindset, had an effect independent of other factors. And this is very interesting because we have a non-biological thing, optimism, optimistic. It has biological effects. It might have some biological components in being optimistic. Being optimistic might have some biological components. There are some studies showing this is not included in this study. It is included in other studies about optimism. We'll have a class specific about that. But there is an independent effect of optimism. Optimism has an effect independent of the other factors. I find this information very interesting. So, the conclusion part of the abstract, the conclusion and relevance part. The findings of this study suggest that optimism is associated with a lower risk of cardiovascular events and all-cause mortality. Future studies should seek to better define the bio-behavioral mechanism. It's not only behavior, it's bio-behavioral mechanisms underlying this association, and evaluate the potential benefits of interventions designed to promote optimism or to reduce pessimism. Now, we're going to take a look at each section of the article in full and talk about them a little bit in more detail. Now, let's read together the introduction section of the article. I will not read all the sections in its entirety, but this introduction is very interesting. It's easy to understand, and I think it's worth reading it in full. So let's read together. Extensive evidence has demonstrated an association between negative emotions, social factors, and certain chronic stress conditions and adverse cardiac outcomes. This phrase is important because it shows us that we're not only studying biological factors like hypertension, diabetes, smoking, we're also studying other factors that, even though they might have some biological basis, they might have in part a biological basis, they are not entirely biological, but they can affect biological health. That's very nice. An area that particularly interests me. The article goes on. Less well studied has been the potential association between positive and negative mindsets and cardiac risk. Such research is of interest because mindsets are potentially modifiable, thus making them a novel, relevant target for clinical intervention. One such mindset is an individual's level of optimism, commonly defined as the tendency to think that good things will happen in the future. This is very interesting because for most of the time, we as doctors have focused almost entirely on the biological factors involving diseases and usually the consequences of the diseases. And now we are dedicating more attention and more researches to the study of the roots, let's say, of diseases. That has always been studied, but now we have more knowledge and we are dedicating more research and more resources to it. And also about the non-biological factors that can affect biological health. That's why this particular study of optimism interested me so much. And here they talk about what is the definition of optimism. And optimism is commonly defined as the tendency to think that good things will happen in the future. I will make a video specifically about optimism, including other studies. And we're going to talk a lot about interesting concepts that come up when we think more about how a mindset influences biological health. But that will be topic for another study. Let's come back to the article. So, optimism is commonly defined as the tendency to think that good things will happen in the future. Empirical studies can be called real-life studies, let's say. Studies that looked at people in their day-to-day life outside the context of research facilities, of research context, that try to see what happens to people in the real world, between commas, let's say, between quotation marks, let's say. So empirical studies have long indicated that more optimistic individuals are more likely to succeed at work and in school, sports, politics, relationships, and other forms of life endeavors. So, the study continues. A more recent study also reported positive associations between optimism and a range of favorable physical outcomes. Do you notice what is very interesting to this? This is a paper talking about cardiovascular health. That is a biological thing. We will talk about cardiovascular events of myocardial infarction, death, stroke, biological events in nature. But we are talking about optimism. We are talking about something that, even though might have in part some biological basis, is fundamentally a non-biological factor. But it can influence biological health, but it can influence not only biological health. It also appears to have a positive effect on non-biological things, and non-biological things that are very relevant to the life of people. Their success at work, school, politics, relationships, and of other lives of form endeavors. This is not the topic of this article. Now I'm entering a tangent, but I think it's worth saying this. This might mean, let's consider that being optimistic is good for you in terms not only of biological health, but also in life as a general. This might show us that the factors that bring biological wellness might also be beneficial to other aspects of life. That might also mean that biological health is not isolated from the rest of the life of that individual. But biological health is one part of a broader scenario. That is the life of that individual. And negative events, negative things in biological health might come together with other negative things in other aspects of the entirety that is that individual. This realization is not new. If you take a look at the definition of health of the World Health Association, in the 19th century, it says that health is not only the absence of biological diseases. It includes a lot of other aspects. It includes psychological well-being, social relationships. It includes spirituality, not only the religious aspect, but spirituality in a broader context. But this study lets us think not only that the definition of health include other things besides biological well-being. This study can let us think that in lay terms, maybe what is good for your biological health might also promote beneficial effects on other aspects of life. I think that's a very interesting topic. We're gonna talk more about them on other videos, on other opportunities, but that was a tangent. Some of that tangent had some personal bias, my personal opinion on the topic. It's not only my opinion, this opinion is shared among other individuals, and there is some scientific research about this, but this is not what this paper talks about. This was a tangent, and now we're gonna get back to the reading of the introduction. So, we read that a more recent study also reported the positive associations between optimism and a range of favorable physical health outcomes. Nevertheless, the assessment of optimism and pessimism in cardiac medical practice is uncommon. Not only on cardiac medical practice, I think it's uncommon in medical practice as a whole. I didn't research this topic in specific, I'm talking just about my experience, but it's probably not, the assessment of optimism and pessimism is not, it's not usually made outside psychological health context. There are another tangent, there are some let's say methodologies, some areas that include this as part of the routine evaluation of the patient. For example, lifestyle medicine, some patient-centric approaches, they include this assessment of optimism, pessimism, and other factors as a central part of the day-to-day healthcare, let's say. But overall and over time, the assessment of optimism and pessimism was not very common in clinical practice, in day-to-day clinical practice. In 2001, KUBZANSKI and colleagues reported the first study, to the knowledge of the authors of this paper, to find an association between higher optimism and a lower risk for specific cardiac outcomes, including angina. Angina is chest pain related to coronary heart disease, myocardial infarction, and cardiac death. They showed effects of optimism beyond those of depression, or other forms of psychological distress. A critical finding, because the concern about such findings is that they simply reflect the absence of depression rather than active effect of optimism. Since then, similar findings have been described in other studies. This is very important. They were afraid that in the beginning that the effects they were seeing in optimistic people simply meant that optimistic people were not depressive, and the presence of depression, they were afraid that the presence of depression caused negative effects, and being optimism was the normal state, let's say, of the absence of depression. But what they found was not that. They found that depression is one thing, the absence of depression is another, and being optimistic is a third thing. The effect of optimism was not the absence of depression or psychological distress. It was an independent factor. Being optimistic was something different. Being optimistic was not the absence of psychological distress and of depression. Psychological distress and depression have negative effects on health, but the effect of optimism is not just because you don't have those negative effects. There is a positive independent effect of being optimism. There is separate from not having psychological distress and not having depression. To consider these findings more systematically, we conducted a meta-analysis of studies that have assessed the associations between optimism and pessimism and adverse cardiac outcomes. Our goals were to evaluate the magnitude of this association, the consistency of results among reported studies, the influence of potential confounders. Here, for example, they mentioned that since they saw that depression and psychological distress also affected biological health, but they were different from being optimistic, most studies consider depression and distress a potential confounder, and they tried to eliminate or minimize the effect of these things when they looked at the specific effect of being optimistic, and the quality of the reported literature. Now, we're going to take a look at the methodology section of the study. So, the methodology section begins by talking about the data sources and the methodology of the search to find this data. So, they begin. For the systematic review and meta-analysis, PubMed, Scopus, and PsycInfo databases were systematically searched for articles published from the inception of the databases through July 2, 2019. Remember, this study was published on 2019. With the following medical subject heading terms. And here you can read all the terms they use. No language restrictions were imposed for the search. In addition, references from included studies and pertinent review articles were searched to identify other studies meeting selection criteria. Let's stop here and digest this phrase a little bit. First, what is a systematic review and a meta-analysis? Putting it very simply, a systematic review is a review of the literature, but it's not any review. It's a review that follows specific rules. So the studies that will be included in this review must satisfy a set of rules to be included. Why is that? Because in that way, we try to, first of all, select the studies that are most pertinent to the question we want to answer. Second, we try to select the studies with the best qualities to answer our research question. And finally, with all that, we try to arrive at the best possible answer, an answer of the best possible quality. That's why we make the review following a very specific set of rules. All of this is to try to end up with the best possible answer, with an answer of the highest possible quality. And what is a meta-analysis? A meta-analysis is a type of statistical analysis. So we made this review, we have our studies that satisfied all those rules, and these studies, they each have a result. For example, for the reduction in mortality for being optimistic. Each study has a different result for this. A meta-analysis is a statistical tool that you can apply in systematic reviews, for example. So you can have systematic reviews that don't have a meta-analysis. A meta-analysis is not obligatory for a systematic review, but it can be made when the data, the results you're interested in is numerical, and when the studies that you have in your systematic review are similar enough so they can be compared and they can be joined in the meta-analysis. If your studies are too different, then you cannot make a meta-analysis. So they made the systematic search. They made that on these databases, PubMed, Scopus, and PsycInfo. What are these databases? These databases are databases that the scientific research is available to be searched on. For example, let's take a look at PubMed. You can search PubMed on Google and arrive at this site, and here you can search for articles. So on this paper, they used these terms to make the research. Let's use one of them. Let's search for optimism. So we can get here on PubMed and search for optimism. When you search for optimism, you get some results. Each of these results is a different article. So they made the search in PubMed and on other databases. They didn't restrict the language, and they selected the studies. No language restrictions were imposed for the search. In addition, references from included studies and pertinent reviews articles were searched to identify other study methods and selection criteria. The present systematic review and meta-analysis was conducted and reported according to recommendations of the meta-analysis of observational studies in epidemiology guidelines, the MOOS guidelines. What is this? This is a set of rules, of suggestions that recommend some practice so you can make this research and report it in the best possible way that facilitates understanding, that facilitates reproducibility, and that tries to minimize errors. This is one of the possible guidelines. There are other possible guidelines you can follow. So let's talk about the selection of studies. Two of the researchers, AR and CB, independently identified articles eligible for review. Articles were selected for inclusion in the meta-analysis if the study evaluated associations of optimism with all-cause mortality and or cardiovascular disease events, and reported adjusted risk estimates with 95% confidence intervals. We're going to talk a little bit more of this on the results and in further parts of the methodology sections. Studies of patients with cancer were excluded to avoid confounding secondary to terminal sickness. Articles were identified for further review by performing an initial screen of abstracts, followed by full text review. What is this? So, they made their search. For example, here, this is not the exact search they made, but this is just to make an example. So, they made the search, and articles were identified for further review by performing initial screen of abstracts. So the first thing they took a look at was the title and the abstract. For example, here is the title, here is the abstract. And they took a look to see if this had to do what they were interested in searching. If the article had to do with the research in question, then they went and read the article in full. This is an open access article, for example, so I don't have any problem showing this to you. If the article did not have, was not related to the research question, they stopped at this step and didn't read it in full. Only empirical articles were considered. So they didn't consider articles that made interventions to the group of people. They didn't consider experimental studies. With regard to multiple studies from the same data set, only one article was included and selected based on relevance, clearly defined outcomes, and a large sample size. What they mean here is the following. Let's say you make a research, and after you finish, you have all this data. You can use all this data. And let's say now you're going to use this data to make a research paper. You can use the entirety of the data, or you can use a part of it. And then you can make then another research with another part of it, and then another research with another part of it, and then another research with another part of it. They only consider, in cases such as this, they only considered one specific paper because they said that this paper was very relevant and it had high relevance, clearly defined outcomes, and large sample size. So they only included one specific paper of this nature. Now they talk about the extraction of data and the quality assessment. The data was independently extracted by two of the researchers using standardized protocol and reporting forms. This means that these two researchers each made the same research, and after they found the papers that satisfied all the research criteria, they then each independently extracted the information of the research, and then they confronted the results of each of their efforts. When there was disagreement, they resolved it by arbitration. They talked about it and tried to find a middle ground. The consensus was reached after discussion. The following information was extracted, and here we can see all the information that was extracted. That means characteristics of the study itself, especially the size of the sample, the duration of the follow-up, that means for how long that group of people were followed, the characteristics of the study sample, that means the mean age, sex, and major comorbidities present in that population. This part is important, the main exposure, that means the method with which was assessed optimism and pessimism. There are different tools you can use to see how optimistic or pessimistic a person is. And they recorded what method was used in each study. And the main outcomes. The main outcomes were all-cause mortality and or cardiovascular events. They also had other secondary outcomes. Here they talk a bit about the statistical analysis. Adjusted relative risks or hazard ratios, 95% confidence intervals, and information about the variables used for adjustment in multivariable analysis were abstracted. What does this mean? Relative risks and hazard ratios are two different measurements of risk. They are not the same, they are a bit different, but they are all measurements of risk. We're gonna talk a little bit more about them in other videos. But they are a measurement of risk. So they were interested in these measures of risk, and everything else they did was to try to make this information as certain as possible and to measure how confident they can be in this information. All these other topics over here relate to this purpose. We're not gonna talk in details about confidence intervals, adjustment, and multivariable analysis right now. But one of the things they also did to that purpose was to measure and grade the quality of each of the studies that were included in the systematic review. So after they made their systematic search, they arrived at the studies that satisfied all their conditions to be included. They took each of the study, analyzed each of the study, and gave grades using the Newcastle and Ottawa scale. They gave quality grades based on how the study groups are selected, how each particular study was comparable to the other ones, and how the outcomes were assessed in each study. Here is the section that enters in more detail about how they did the statistical analysis in this study. We're not gonna enter deep into this. This is a very complex part. There are many different tools and techniques being used. What is important to know is that the study was mainly interested in measurements of risk, the relative risks or the hazard ratios, and in arriving at the most precise and confident answer it can arrive, and to measure how much confidence it can have on its results. Everything they did in their statistical analysis was to those purposes, to arrive at the most confident result possible and to measure that confidence. This is the ultimate purpose of all of the techniques employed in this section. So now we enter the results of the article, and it begins by talking about the study characteristics. It says, a flow diagram of the literature search and related screening process is shown in figure 1. So let's take a look. So here in figure 1, they show how was the process of study selection. So when they began, they had 1,606 records identified. Most of them were in those databases, PubMed, PsycInfo, etc., and 17 were in other sources. But there were some duplicates among them. So after they eliminated the duplicates, they had 1,593 records to screen. So they read the titles and abstracts of these articles, and they eliminated most of them based on this, and so they had 39 articles that were read in full. Of these 39, 24 were excluded for different reasons, and they ended up with the 15 studies that were included in this review. Of these 15 studies were published between 2001 and 2017. 14 were prospective studies, and 1 was a retrospective cohort study. So what does this mean? All these studies were cohort studies. So these were studies that studied what happened to a group of people over time. But there are 2 ways to do this. Most of them were prospective. That means that the researchers were with the populations at the beginning and followed them up over time, recording what happened. The retrospective cohort was the contrary. In the retrospective cohort, the researchers begins the research after everything has happened, and everything that was happening is already recorded. They just extract this data from the records to see what happened to this population over time. This is the main difference between the prospective and retrospective cohort studies. Overall, the 15 studies included 229,391 individuals, and the characteristics of these studies are summarized in Table 1. Let's take a look at Table 1. Here we have the main characteristics of the studies. Each line is a study, and most of these studies were from the community. They're not from a medical or university context. Most of them were made in the community. There was a lot of difference on the sample size of the number of participants in each study, but the one that had the smallest sample size had over 500 people. You have the sex distribution among people, among the population of each study, the mean age and the smallest age and the biggest age of participants in that particular cohort, the follow-up in years. There was one that followed them up for 40 years. That's impressive. And you have the method that was used to assess optimism. You have many different methods, but you see that LOTR is the most used method. So let's take a look at it. So here we have that this is a questionnaire that each patient would respond over time. It has 10 questions. Each question can be answered using a number from 0 to 4. 0, so for each sentence you read it and you answer how much you agree or disagree with that sentence. So for example, if you read sentence number 1, in uncertain times I usually expect the best, you can, if you strongly disagree, you answer 0. If you disagree, you answer 1. If you are neutral, you answer 0. If you agree, you answer 3. If you strongly agree, you answer 4, and so on. And after all that, you have you calculate a score. This questionnaire doesn't only assess optimism, it also assesses pessimism and other things, but it's the most used instrument to assess optimism. And you also have the endpoints that were evaluated in each study, and you can pause the video, look up the abbreviations, and see what were the main endpoints that each study considered. There is another very interesting information about these studies is that they had a varied geography. 8 of these studies were from the United States, 5 of them were made in Europe, 1 in Israel, and 1 in Australia. This is very good. It means that the results of this study are more applicable to many different populations and many different contexts. Another important part was that when they graded the studies based on quality, used the Newcastle-Ottawa scale, all studies had a low risk for bias. That is good. That means that overall, all the studies had good quality. That means that the information we will get from reviewing the studies will probably also have good quality. So, main results. Remember, we had 2 main outcomes: incident cardiovascular events and all-cause mortality. So, about the association between optimism and incident cardiovascular events, of 10 studies reporting cardiovascular events on 209,436 participants, optimism was significantly associated with reduced risk of cardiovascular events, relative risk of 65%. That means the risk of the optimistic group, or the most optimistic group, was 35% lower than the risk of the other group, either the pessimistic group or the less optimistic group. Let's take a look at figure 2. This is a forest plot. This is a type of graphic that is used to represent the results of a meta-analysis. Each line and each square represents one study. So this is the study, this is the result of the study in numbers, and this is a figure, a box with 2 lines to the side that represent the results of this study. So here we have the graphical representations of each of the study results, and here we have a diamond. This diamond is the summation of all of these studies, but they are not summed equally. They are weighted. The largest studies, particularly the ones with the largest sample sizes, have a greater weight than the ones with smaller sample sizes. Here we have the weight that each article contributed to the final summation, to the overall result. And you can notice that there is a dashed line, a vertical dashed line, and the results there are to the left of this line means an association of optimism with reduced risk of cardiovascular events. And on the contrary, on the right side, and you can see that almost all the results were to the left of this line, including the overall result. So the diamond is completely to the left. It does not touch the dashed line. So we can say that for this outcome, being the incidence of cardiovascular events, optimism was associated with a reduced risk, and that this reduction is statistically significant. We'll talk about what it means for a result to be statistically significant in other opportunities, but this is a very relevant observation for policymakers, for researchers, and for professionals who read these studies. If a result being either the results of the box with the lines or the diamond touches the dashed line, we say that this particular result was not statistically significant. But when you consider the overall result for this outcome, there was a significant statistical association. When you consider the other main outcome, that being all-cause mortality, we had 9 studies reporting on all-cause mortality, which included 188,599 participants, and overall optimism was significantly associated with reduced risk of all-cause mortality. The group that was optimistic or more optimistic had a 14% reduction in the relative risk of mortality compared to the other group. Let's take a look here at figure 3. This is another forest plot, this time for the association between optimism and all-cause mortality. Here we have each study that contributed to this meta-analysis, their results in numbers, and a graphical representation on the box with the lines. And we have the diamond, that is the summation of all the studies, considering the weight of each one. And we have the overall result. It is to the left of the dashed line, which means that that optimism is associated with a reduced risk of all-cause mortality, and the diamond does not touch the dashed line, which means that this result was statistically significant. Going on, another interesting analysis they did was subgroup analysis. What does this mean? This is the overall analysis with the entire sample, and we found these overall results. A reduction of 35% of the relative risk concerning the incidence of cardiovascular events, and a 14% reduction of the relative risk when you consider all-cause mortality for the groups that are more optimistic. Alright, but that is for the entire sample. What about subgroups of the sample? Is the effect of optimism different depending on different subgroups in the sample? So they consider different subgroups based on many different characteristics. Subgroup analysis was made by method of assessment for optimism. So you had different subgroups based on which method was used to assess for optimism. You have different subgroups based on the follow-up duration of that study. You had different subgroups based on the most prevalent sex of that cohort. You had different subgroups based on the location, based on the presence of absence and the consideration of depression for that result, educational level, socioeconomic status, and exercise of physical activities. And overall what they found that even when you consider all these different subgroups and the presence of all of these different factors that might confound the results, when you adjust and consider all that, optimism and pessimism still had a relation to cardiovascular events and all-cause mortality. Optimism was still associated with a reduced risk of cardiovascular events and all-cause mortality. We can take a look here at table 2. Here we had the risks and the different subgroups. In this table, when you see a number smaller than 1, it means a reduction associated with optimism. That means that optimism was associated with a reduction of that outcome. It can be cardiovascular events in this column or all-cause mortality in this column. And here we have the different subgroups. So there was an association when the subgroup were the people that used the LOTR and that used other instruments to measure, when the predominant sex was either male or female, when the country was the United States or other regions, when you adjusted or not for the effect of depression when the group was followed up for less than 10 years or for 10 years or more. And this is very interesting, for factors that are associated with optimism but can also impact the incidence of cardiovascular events or all-cause mortality. For example, people who are more optimistic, as we saw in the introduction, we have data that suggests that they do better educationally, they have a higher educational level, they have better employment, higher socioeconomic status, and they have higher levels of exercise or physical activity. But even when you consider the effects of each of these factors, in every time optimism was still associated with a reduction of cardiovascular events and all-cause mortality. Another very interesting evaluation they did was the assessment of linear trend. What does this mean? It means that the higher the level of optimism, the greater the effect, the greater the reduction in the incidence of cardiovascular events, and the greater the reduction in all-cause mortality. In 12 of the 15 studies, this significant linear trend was observed. We call this a dose-response effect. Now we begin the discussion section of this article. It begins by reviewing some information it has already presented in the beginning of the paper, at the introduction. It says, a review of the literature has noted associations between a number of psychosocial risk factors, including negative emotions such as depression and anxiety, social factors like loneliness, and certain chronic stress conditions with cardiovascular disease. Specific mindsets, habitual patterns of thinking which influence individuals' views and interactions have also been associated with cardiovascular disease risk. Using the strongest epidemiologic methods available, a growing body of research has investigated whether the mindset of optimism versus pessimism might be associated with cardiovascular disease, and has also explored potential mechanisms underlying these associations. The article then goes on to more or less repeat the results, and then it begins the discussion about some aspects of the findings of this paper related to the literature. So it begins by discussing the methodological differences among the different studies that were part of this review. And it states that there was a considerable variation in the methods and the questionnaires used to assess optimism and pessimism. The most used questionnaire was the Life Orientation Test Revised, the LOTR. But there were other types of questionnaires used. Some of these questionnaires used a scale. Others classified the individual on categories of optimism, but independent of the tool that was used to assess optimism and pessimism, the association of optimism with a reduced risk of cardiovascular events and all-cause mortality was observed regardless of the instrument used, and also regardless of the time of the follow-up, of the duration of the follow-up, regardless if there were less than 10 years of follow-up or more than 10 years of follow-up. The article also discusses the assessment of potentially confounding variables. It begins, in general, the risk ratios, the measurements of risk used for this meta-analysis were adjusted for a variety of potentially confounding clinical variables. Now, this is important. Most studies that were included in this review adjusted for some, if not all, major cardiac disease risk factors. It means that when they did the literature review and then they extracted the risk measurement from each study, those studies provided the adjusted risk measurement. That means that risk measurement already considered the possible impact of different cardiac risk factors, of comorbidities these individuals might have, and took precautions to minimize that confounding effect. It also begins to say that many studies also adjusted for psychological distress to rule out concerns that associations were primarily attributable to the absence of depression. We talked a little bit about that on the introduction and methodology parts. And approximately half of the studies presented estimates also adjusted for educational levels and physical activity. We talked a little bit more this on the results section. Saying once again, the protective effects of optimism were maintained among studies adjusting for these variables. That means that optimism has an effect that is independent of the possible effects that optimism has on these other variables like socioeconomic status, educational level, of exercise and physical activity levels. They contribute to cardiovascular health. But the effect of optimism is not entirely dependent on them. Also, the protective effect of optimism was kept even in studies that had a higher prevalence of men compared to women or vice versa, and among studies that were made in the United States and that were made in other regions. The study also discusses the assessment of outcomes according to the magnitude of optimism and pessimism. What does this mean? This section basically talks about those response effects, that in 12 of the 15 studies, what they found was that the higher the level of optimism, the greater the benefit, the greater the reduction in risk that was associated. We call this a dose response effect. And it was maintained even in studies that use different methodologies. And this is very interesting because this dose response effect that we verify here in optimism also happens for the clinical hazard of cardiovascular outcomes that is associated with other psychosocial factors like depression, poor social support, other psychosocial risk factors. The discussion also has this section when it talks about comparison of this study with other studies that studied optimism and its relation to other medical conditions. The article begins by saying that this present research that we are reading was the first meta-analysis to the knowledge of the authors at that point in time to assess the associations between optimism and clinical outcomes. But there were other studies that were previous studies, even though they were not meta-analysis, that also investigated the association of optimism with clinical outcomes. And many studies found an association. These include studies that have shown an association between optimism and the risk of heart failure, of the risk of the development of cognitive dysfunction among elderly people, the rate of atherosclerotic progression, and of respiratory diseases, infection, and various cancers. So there is an association of optimism with many different health outcomes, not only cardiovascular disease, but they involve a variety of other health outcomes, which means that somehow they must be based on something very fundamental to health. So in this section, they discuss the possible mechanisms through which optimism and or pessimism might play their role to the benefit or to the harm of health. And basically they say that there are behavioral mechanisms. For example, people that are more optimistic tend to exercise more, and they cite studies that show this. But also that there are direct physiological mechanisms. It means that optimism and pessimism affect biological health directly. They don't need the behavior mechanisms to do that. And this is also true for other psychosocial factors, mainly depression. Depression may be the most studied one. They mention that there is evidence about the association of optimism and pessimism in a variety of mediators of chronic diseases, like increased inflammation, impaired hemostasis, this is the control of thrombosis and bleeding and the prevention of bleeding, endothelial function. The endothelium is the innermost layer of the blood vessels. It's very involved in cardiovascular disease with telomerase activity and telomere length. This is most involved in cell cycle studies and longevity studies, with blood pressure, and with the hypothalamic pituitary adrenocortical function. This is a hormonal axis that is very important to many different functions in our organism. Together, these findings suggest a direct association of optimism and pessimism with physiologic functioning, although the study of individual mediators remains sparse. We need more studies to understand these mechanisms better. Next, they discuss the clinical significance of the findings of this study. Well, they say that optimism has long been promulgated as a positive attribute for living. And the findings of the current meta-analysis of this study suggest that optimism is associated with cardiovascular benefits and that pessimism is associated with cardiovascular risk. And this association is similar to that for well-established cardiac risk factors. So this is very, very relevant. We have to pay attention to this. Now, taken together, the benefits of optimism regarding cardiovascular health and psychological well-being make it an attractive area for study. And they suggest 3 main points that future research should address to arrive at more and better answers. First, there is a need to better understand the processes that underlie the medical benefits associated with optimism. We have to understand these correlations, these pathways, these mechanisms better. Second, it would be better to have more standardization of the methodology used in research of this area. Maybe decide on a single instrument to measure optimism, to standardize the approach as much as possible, to allow for better comparability between studies and to arrive at more robust conclusions when you join the results of different studies. And third, the findings of this study support the further studies to study the effects of interventions that might diminish pessimism and promote optimism and their effect on clinical patients. Various studies have reported that pessimism can be reduced and optimism can be enhanced through the use of different techniques, cognitive behavioral therapy, positive psychological techniques. But we'll have to see if the effects of optimism induced by these techniques is similar to the effect of naturally occurring optimism, because in a lot of research we see that for some people optimism is a natural characteristic of their personality. We don't yet know if optimism that is induced or facilitated by the use of external techniques has the same effect to the naturally occurring optimism. Also, the results of this study may be encouraging for us to take a look at the effects that could happen if we instill other positive mindsets. For example, a sense of purpose or gratitude that may be elicited through guided interventions. So we don't have to restrict the future research just to optimism. We can study the effects of the sense of purpose or the effects of gratitude. And if we enhance these positive mindsets, if that has a positive biological effect. And they discuss about the limitations of this paper, of this research. This meta-analysis, according to them, has several limitations. Most of them are related to the different methodologies, the different characteristics of the sample of each study. Some of these differences might be considered weakness, but at the same time they might be considered strengths, because since you studied different populations and you found that optimism was associated with a reduced risk of cardiovascular events and mortality from all causes among all of these different populations of different sexes, different regions, of different ages, different age groups, even though that might make direct comparisons difficult, overall it is a strength. It reinforces the proposition that optimism is in general beneficial to health. And they talk a little bit more in detail about the difficulties they had, about these different methodologies, about this heterogeneity that they found among the different studies. And finally they conclude by saying the findings of this meta-analysis suggest that optimism is associated with a lower risk of cardiovascular events and all-cause mortality. Future studies should seek to better define the behavioral, it's not just behavioral, it's behavioral mechanisms underlying this association and evaluate the potential benefit of interventions designed to promote optimism or reduce pessimism. I thank you all for your time and attention. I hope this was enriching to you, and I'll see you in the next one.